Are you experiencing pain while passing stools? You could be suffering from something called as anal fissure, which is tear in anal mucosa. But don't worry, today I'm going to explain everything about anal fissure. What is it? What are the causes? What are the symptoms? How homeopathy is helpful in this case? And at the end, I'm also going to talk about lifestyle tips. Hello everyone, I'm Dr. Tanvi Mahant and welcome back to my channel HomeoHeals. So anal fissure is a cut or tear in the anal mucosa, and because of which the patient experiences severe pain and discomfort while passing stools. So a lot of patients confuse anal fissure with piles, but these are two different things. Anal fissure is cut in the anal mucosa, while piles are swollen veins in the rectum and anal area. Now talking about what are the causes of anal fissure. Most commonly, patients present with constipation and hard stools. So a lot of straining during stools. Okay, there is a often history that they are sitting in the washroom for half hour, straining, and this straining causes cut or fissure in a anal mucosa. Also nowadays people have a habit of carrying their phone to the washroom, because of which also there is a straining during stools. It is also common during pregnancy, during childbirth. Also people who have chronic diarrhea, because of the irritation of the anal mucosa, they could experience cut. Certain inflammatory diseases like Crohn's disease are also prone to develop anal fissures. So these were the causes. The most important thing is, what are the symptoms? Symptoms are they could experience severe pain, which is burning like or cutting pain during stools. So as I mentioned, that is a cut in the anal mucosa. So whenever the stool passes over that cut, they experience severe discomfort and pain. This pain could persist even after passing stools. Okay, there is itching in that area, there is burning in that area. Patient might also experience certain discomfort throughout the day. Bleeding is also common, but bleeding is mild. Okay, when you clean that area with toilet paper, you could see blood. So, and also there is a lot of spasm of the anal splinter. So these are the common symptoms of anal fissure. Most commonly people who have a sedentary lifestyle, that means they have a sitting job, no physical activity, a lot of mental stress, are also prone to constipation of hard stools and anal fissure. So it is like a vicious cycle. So we spoke about the symptoms. Now if this anal fissure or cut persists for more than 6 weeks, we call it as chronic fissure, and which requires a proper treatment. Now because of this chronic fissure and chronic straining, what happens, people develop something called as sentinel piles or skin tag in that area, and because of which the anal opening becomes more narrow and patient has a lot of difficulty in passing stool and severe discomfort and pain. So homeopathy has large number of remedies for fissures, and which are helpful and which can treat and cure your problem of chronic fissures as well as acute fissure. So we focus a lot on the symptoms, acute symptoms, and also the overall personality. Now sometimes, as I said, that stress is also a cause of fissure, because stress leads to spasm of the muscles and contraction of anal splinters. So people who have a lot of stressful job are also experience this anal fissure. So homeopathy medicine depends upon the symptomatology, but certain remedies which are helpful are Ratanhia. You have remedies like Nitric Acid, Silicea, Nux vomica. These are few examples, but do consider going to homeopathic doctor, consult a homeopathic doctor, and only then take a remedy, because that is going to help you in much better way rather than doing certain self medications. So this was about homeopathic approach and treatment. Now what are the food which you need to avoid in this condition? Firstly is junk food, deep fried food. Refined carbs and refined sugar should be avoided. Okay, so these are the two group of foods which should be avoided. Also, a lot of highly spicy food should be avoided by these people. Now, foods which should be included in diet is basically foods which are high in fiber. That means fruits, vegetables, whole grains. Maintaining hydration is very, very important. So, drink enough fluids because that is going to prevent constipation. Right, as I said that it is also because of stress. So certain exercises, okay, doing yoga will help you to calm yourself and also help you to improve your bowel movements. So these are certain lifestyle changes which you can incorporate in your life. Okay, certain dietary changes which I advise. Okay, now along with homeopathic medicines, what is that you can do, okay, to minimize the pain and suffering during the acute episode. So the most common one which I advise to my patients in clinic is seeds bath. That means in a tub you need to take lukewarm water, okay, and sit in that water for maybe 5 minutes 2 to 3 times a day. It will help you to relax your anal muscles, anal splinters, and minimize the pain. Locally, you can apply certain lubricants like coconut oil. Okay, so these are the few things which you can do at home along with homeopathic medicines. But homeopathic medicines help and treat this condition permanently. So if you suffer from this condition, do contact a homeopathic doctor. If you want to consult me, do write down in the comment section. I hope this video was helpful to you all. If you are new to my channel, like this video, subscribe to my channel, and stay tuned for my upcoming videos. Thank you.